Just, just a minute. I'll be just sharing my screen. All right. Hello, all the doctors and homeopathic students. Today's topic is CKD, homeopathic management of CKD. Since you all know, CKD has become a big problem these days, and a lot of people are being affected with CKD, chronic kidney disease. Little children are coming to OPDs with CKD, with nephrotic syndromes, and you must be, I hope you all must be dealing with such cases in your daily practice. Am I audible?
Yes, yes, ma'am.
Okay, okay, thank you, thank you. Yeah, so CKD, chronic kidney disease, one of the major health issues of today, especially after COVID, the cases have increased drastically. Small children's, small youngsters, students are being affected, and it's very shocking to see such cases in the clinic. So starting with our first case, there's one thing that I would like to clear, that CKD is a condition a little negligence can cause direct death of a patient. That's why we need confidence, we need good knowledge of homeopathic remedy, good knowledge of the disease. First of all, we should know the disease, what the patient is suffering from. Then we'll decide, okay, now the patient is suffering from this syndrome, this, is it autoimmune, is it due to hypertension, it is due to diabetes, or whatever the cause is. We need to get that clear. Then we have to make a plan of the disease, of the treatment. What the treatment we are giving to give to the patient, and according to the disease, we'll know the prognosis, right? We'll be uh, more careful about what medicine we are giving. If we make a mistake, what could be the harmful effects of that medicine, right? We cannot always suppress the symptoms. We have to sometime leave the symptoms, because if we give a medicine, if we suppress such a symptom, and it will cause a greater disease in the patient. So I have been dealing with CKD cases in my clinic for last 2 to 3 years, and I have learned this art of homeopathy from my father, who has been practicing homeopathy since last 35 years. Now he is no more. He expired 1.5 years ago, and I'm carrying that legacy ahead. So starting with first case, you will see in this case, you see in the cases that my approach is constantly changing according to the disease, according to the cause of the disease, right? With every patient, I am choosing a different approach. I'm not sticking to one method. I am sticking to the method of the patient, what my patient requires at that time. And I hope, so starting with case number one. This patient was suffering from CKD. With hypertension. Just a minute. Yeah. The patient was suffering from CKD with hypertension. The patient name was Nisha, and age was 21 year old. She was very young. And she had CKD for last 3 years. She has gone to different doctors. She had tried many treatments, Ayurvedic, homeopathic also. She had tried allopathic treatment gradually. The condition was constantly worsening. Her chief complaints was the main complaint was the patient was constantly saying that mujhko sahi kar do, please just cure me, right? The creatinine levels when she came to me was 7.2, and the patient was suffering from severe hypertension. The blood pressure was 7 systolic, 770 mmHg. Despite taking allopathic medications, despite taking homeopathic medications from somewhere else, they were getting a treatment. So no medicine was working. She was vomiting in the morning after waking up. There was heaviness and pain in the kidney region. There was severe headache in the temporal area. There was headache, and she was having severe episodes of headache. And she was taking allopathic medicine. Allopathic medicines were not able to control her blood pressure, and neither it was able to control her creatinine levels. Right. Hmm. So we started the treatment, and there was definitely a direct connection of the mind and the body in this case, right? So the case history was a page at the age of 17. What happened with this girl at the age of 17? The family of the girl started talking about her marriage, and that led to anger burst out. Patient strongly opposed the marriage idea of marriage, and she felt that she will get control and she will not be free. And whenever there was a discussion about marriage in a family, the condition of the girl got worse. Every time there was a discussion, there was a that led to a anger outburst, that led to headache, that led to vomiting. Every time this discussion was happening, the girl was getting irritated, and that led to falling sick. So patient's own word at that, the patient told me that when she was 17 years old, when her family started arranging her marriage, she used to think, why are they getting me married so early? I have elder brothers and sister in the family, so why are they insisting on my marriage first? From that time, these discussions about marriage started. My health problem also began. So there is a direct link between the mental state and the physical state. Whenever the topic of the marriage came up, I would become extremely angry. I would cry, shout, argue with my family members. I did not want to get married and felt that nobody was listening to me. I used to hide under the bed. Yeah, this is a very important symptom that whenever she got angry, she used to hide under the bed or on the loft where nobody could see her. On the loft, she was climbing. So at this extreme, she was hiding from everybody. That on the loft, she used to climb. Loft, you know that in the village, in the old houses, in the villages, there is a thing called machan, जिसके ऊपर हम लोग अपना सामान रखते थे. So on the loft, she used to climb and hide there. And when she hid, she used to feel a little comfortable and relieved. The conflicts at home continued for a long time. Gradually her menstrual period suddenly stopped. My headaches became much more severe and frequent. Whenever I became upset, I cried. The headaches would become unbearable. She was having unbearable headache, and when she came to me, she was having unbearable headache and vomiting in the morning. Later, when I got my blood pressure checked, it was found to be very high. I kept using different doctors for treatment. After some time, investigation revealed that my kidneys had become damaged and I was diagnosed with chronic kidney disease. So here she was diagnosed with chronic kidney disease. So clinical findings. When she came towards the clinical findings was creatinine level was 7.29, blood urea 106, blood pressure 170 by 110, and pulse was 96 beats per minute. These were her reports when she came to me on 11th of April. The reports are there, and the girl is also anemic. She is under the effect of erythropoietin injection. That's why her blood levels are above 7. But she's actually under erythropoietin. Her actual hemoglobin is much lower. These were the rubrics that we took. You can take a screenshot. The first rubric that came to my mind was admonition aggravation. Admonition, whenever a little advice is given by an elder, there is aggravation, there is anger. This is a very typical teenage behavior when a small advice is given. You say somebody not to do something and they get very angry. Admonition, little advices aggravates. They don't like to be advised, no? Closing eyes emulates. Whenever she was going inside, whenever she was hiding from her problem, she was going on the loft, she was going under the bed. It was relieving her problems. There is light desire for. What is light in this case? The light in this case is a freedom that her family is trying to.
Hello, hello.
Hello, we'll have a question answer session later. Yeah. Whenever she was hiding, whenever she was going on the loft, she was feeling much better, right? That's why closing eyes ML. She was closing her eyes and she was getting evaluated, right? And there is light desire. For what is light in this case? The light of for her is her freedom that her family is trying to snatch from her by getting her married, right? There is rage, fury. Yeah, she used to abuse, she used to throw things, she used, yeah. There is one more thing about this case that I forgot to mention that she showed me cut marks. She used to cut herself with blades. She used to cut herself with knives and she showed me. So this is the extent of her rage. She was not doing it to show to anybody. She was doing it because she was feeling so angry. Rage, fury. There is remorse. Remorse, why? Because she said that she wished she took care of herself. If she had taken care of herself, she would not be suffering from chronic kidney disease because of this chronic kidney disease, she had spent a lot of money. Many doctors were charging 40,000 a month. Homeopaths I'm talking about with no results. There is violent anger, vehement is there. So the interesting part comes now. The main motive of this webinar, and we had a seminar also in Delhi this month only, and after that I'm only conducting this webinar. So the main motive of this webinar is a lot of people are treating CKD, a lot of people are treating different diseases with homeopathy, and the one thing that we always hear that homeopathy is very slow, right? This is what I'm trying to prove to all of you by choosing these cases. The cases I have chosen these cases with a lot of caution because my motive is to show the fast results of homeopathy. I have a case of cured CKD. That person was going under dialysis and now that person is completely cured. I have a testimonial video of him. I'll show that to you later. But these cases I have specifically chosen to show you how fast homeopathy works. So we gave belladonna 200 every night and I asked her to monitor her blood pressure. She monitored her blood pressure. She started taking the medicine. And now you guess how fast the medicine worked. On 11th of April, she took medicines from me. On 12th, sorry, 13th. Yeah. No, on 12th, she took medicine. On 11th, she got a test done. And on 13th, her blood pressure dropped from 170 to 115. Now, this is how fast homeopathy works. So, this is a myth that we need to bust, that we need to clarify that homeopathy is not a slow pathy. Homeopathy is one of the fastest of the treatments. Where allopathy fails, our medicine starts working, and that is the thing that we all need to believe in. So from the next day, her blood pressure reduced from 117 to 115. And why? How do I know this? Because I told the patient to monitor her blood pressure and send the picture to me every day. So on the next day, she sent me this picture with blood pressure 115. Isn't it great? This is how fast homeopathy works. And she had no problem. After this, after the first day of taking medicine, she had no vomiting in the morning. Her appetite increased. Her urine output was absolutely fine. It was fine either way. Medicine लेने से पहले भी she was fine. But ठीक है, there is no need to mention that. Also, her heaviness in the kidney region that got better. In addition, morning vomiting is stopped, completely stopped. Urine output increased, appetite increased, general sense of well-being, and the patient continued the prescribed medicines regularly. Now you remember on what date the patient took medicines from me? On 11th of April, the creatinine levels was 7 to 9 and the blood pressure was not under control. So whenever the medicines start working on kidney patients, overall symptoms, blood pressure, urine output, they starts getting better. Why there is a why blood pressure got better, and why was there a hypertension in the first place? Because renin production is altered in CKD. And in such severe cases of CKD, there is severe disruption in the production of renin that leads to hypertension. And the more the hypertension the patient has, the more creatinine levels will be increased. So on the 11th, she took the medicine, and on the 24th of April, 13 days difference only. 13 days may the creatinine levels came from 7.2 to 6.3. This is how fast homeopathy worked. The blood urea also decreased and the blood pressure was got normal. She did not take any allopathic medicine. There, when I was conducting this seminar in Delhi, a doctor asked me that you stopped allopathic medicine and this could lead to stroke. The patient's blood pressure could go beyond 200 and 220 and the patient could get a stroke, right? First of all, in such cases, we need to be very confident and we need to observe if the medicine is working or not. Then we have to stop the medicines, right? So first, I checked. Yeah, the blood pressure has dropped from 170 to 150. Now I have told the patient that you don't need to take any medicine, any allopathic medicine. And now I have withdrawn all the medicines of allopathy. The patient is not taking any allopathic medicine. So why that doctor asked me that question? Why that doctor was so scared that homeopathy cannot control her blood pressure? What was the cause? One of the causes is most of the doctors, most of the homeopaths are not confident in their pathy. When we are not confident in our pathy that our medicines are going to work, how are we going to convince the allopaths, let alone our patients? If we are not confident in our pathy, if we are not confident in homeopathy, we know that our medicines are not going to work very fastly. How are we going to convince the patient that you are going to get cured with homeopathy? Do you feel this thing in your practice? Our homeopathy is the best pathy. A doctor may fail, but homeopathy doesn't fail. I can cure a patient. Sometimes I fail to cure a patient. I cannot cure everybody. I cannot cure every CKD patient that comes to my clinic. This is the failure of my. This is a failure of Dr. Razeena Nazeer, that I cannot cure this patient. This is a lack of knowledge of Dr. Razeena Nazeer. But it is not because of homeopathy. Homeopathy has a cure for every disease. It is restoring your vital force overall. So we need to be confident. We need to study homeopathy first, deeply. Not we don't have to be stuck only under these 100 and 150 medicines. We are stuck and we are just finding the simillimum among these medicines. We have to go beyond that. We need to read a lot of materia medicas. We need to see what diseases were being cured by our homeopaths in the past, by Dr. Borick, by Dr. Hahnemann. There is Dr. Kent. He has cured so many such diseases. Then why can't we? Where the confidence has gone? Now, this is a very interesting case. Um, I am a little confused actually. I'm finding a way when I can control the PowerPoint and the Zoom meeting. Actually, anyway, we have gone so much so far. We'll continue like this only. So this is the case of uremic conversions. When the blood urea is high, very high, when the blood creatinine levels are above a certain level, it reaches to your brain and the patient starts having convulsions. So the patient was Nasreen, age 45, CKD due to renal cyst. She has little tumors in her kidney, which is usually a genetic condition. And she was having uremic conversion, severe weakness was there, there was chest pain, there was fever, and the urine output was reduced. The patient was admitted in a hospital in Delhi. It was a government hospital in Delhi, and she was admitted in the hospital on 27th of February 2026. And the provisional diagnosis that was written on the prescription of that hospital only was CKD, metabolic acidosis, and severe anemia, right? There were associated features, uremic symptoms were there, convulsive episodes were there, and there was decreased urine output. These are the files of that hospital only. On 26th of February 2026, the blood creatinine levels, serum creatinine was 6.8. It is written right there. It is written right there. Urea was 233, hemoglobin 6.9. And the date you remember. On what date the creatinine levels was how much? 26th of February. And she was admitted in the hospital, and the doctors were forcing this patient to go for dialysis, and the patient and her family was not agreeing for a dialysis because there is a certain myth in the society that if we go for dialysis, it will never stop and we will eventually die and we'll die faster if we go for dialysis. And there are certain financial conditions, not everybody can afford a dialysis. So sometimes they let the patient go. This is a sad truth about our society. On 26th, the creatinine was 6.8, right? The patient is admitted in the hospital. The doctors are forcing the patients to go for dialysis, and the patient is still in the hospital. The patient's son come to me from Delhi, all the way from Delhi to Sambhal. Sambhal is a very small town in Uttar Pradesh, and I practice in Sambhal only, and our clinic is located in Sambhal only for the last 35 years. So the patient's son travels from Delhi to Sambhal to my clinic to take the medicines. The patient did not come because the patient was admitted in the hospital, right? And the patient explain the son explained all the symptoms of her mother, that the mother has this, and he showed me these files in the image only. And the case was incomplete. Yeah, the proper case could not be taken, so there was only one remedy that could come to my mind, and I will tell the remedy's name after. I'll show you the result, what happened after I gave this remedy. So there was no time for repertorization, there was no time for proper case taking, because the doctor is because the patient is admitted in the hospital. On 15th of March, the creatinine from 7 came to 5.4, and the blood urea also decreased. Yeah, you are right. Cupram Ars was given. The remedy that was given was Cupram Ars. After that, on 1st of April, the creatinine decreased further and it became 4.6, and the patient is still in the hospital. And now the doctors are asking कि कि भाई तू क्या दे रहा है दवा, ये क्रेटिनाइन कम कैसे हो रहा है. द डॉक्टर्स, द गवर्नमेंट एलोपैथिक एमबीबीएस डॉक्टर्स आर amazed that what is that thing which is causing the decrease in the creatinine levels. This is the power of homeopathy. When the allopathic treatments fail, our treatment starts there. Cupramas was given, the copper arsenide. There is deficient urinary functions. There are uremic convulsions, headache, vertigo, unconscious conditions from brain edema. It is also given in diabetes, high urine of high specific gravity, increased acetones and diacetic acids. Uremic convulsions preceded by gastrointestinal symptoms. Nephritis of pregnancy. Nephritis of pregnancy is a very common thing that we see in the clinics, and a lot of miscarriages occur because of pregnancy nephritis. And we should remember this medicine Cupra Mars for this. The cardiac rhythm is also affected. Why? Because of defective elimination. Now there is case 3. And this case was completely asymptomatic. There were no sign and symptoms of CKD in this patient apart from a little heaviness occasionally. Dr. Sarfaraz, potency and repetition. Potency was 3x, one tablet 3 times a day. That's all I gave. And still the creatinine is still, the creatinine has decreased from 7 to 4, and the patient is still not came to my clinic. The patient is still admitted in the hospital and I have not seen the patient face to face. So our next case is asymptomatic CKD. I think there are only 10 minutes left in this session. We'll start the session again. I'll send the link again if some things are left unsaid. Patient details. The name was Aftab, age 45, and he was a teacher. There was heaviness in the hypochondriac region, bloating was there, and no significant symptoms. Sometimes there was a decreased urine output, and he thought that he has a little dehydration because of standing. And there was this BLO work and election work going on. The teachers were very busy at that time. He thought it is due to that over work. Absence of classical CKD symptoms. Urine output was mildly decreased. And this case highlights how silent this disease can remain in the body. And only yesterday I got surprised. My gym trainer is same age as mine, and he got a body checkup done, and we find out only yesterday we found out that he has CKD, and his face was like crying. So CKD can remain silent for years. So it is really important if the patient is anemic, if there is a urinary output decrease, if there are recurrent urine infection, get your patient tested for a KFT. So on 30th of September, the creatinine level was 4.7 in this patient. After urea was 66. This is an interesting case. I'll share the PPT in the group only. You can read it from there. I will just summarize it here. The patient wanted a kid, and patient wanted a boy, because the boy would take care of him in the old age, and he was very critical of his wife. Whenever the wife was speaking, he was uh, stopping the wife, that you don't know anything, just stop. He was indirectly insulting his wife, and he had three daughters. He is not satisfied with the daughters because he wants a boy. I'll share the case details in the group. You can read it from there. These were the remedies selected. These were the rubrics selected. Contemptuous, indifferent, apathy. Why apathy is uh, rubric taken here? Because his mother is also suffering from CKD, and she is undergoing treatment from our clinic only. Her creatinine levels was 1.6, and she had diabetic nephropathy. And she loves to eat sweet things. She loves to eat laddus and toffees and everything. And whenever there is mild swelling, and she comes to my clinic running, and her creatinine levels are below 2 now. The treatment started when the creatinine levels was 6. These were the symptoms taken: indifference, selfishness because of the mother only. He doesn't even know the condition of her mother, of his mother. Before, the creatinine level was 4.7 on 30th of September. And on 24th of November, the creatinine level came down to 1.5. So how fast do they want homeopathy to work? No allopathic medicine can bring the creatinine levels from 4.7 to 1.5 without dialysis. It is not possible. Whenever I tell these cases to any allopathic doctor, they do not believe me, and they accuse me of giving steroids or something like that. And I wonder what steroids I have that allopathics don't have. Whenever a homeopathic doctor is giving fast results, they accuse the doctor of giving steroid medicines. अरे यार, आपका पेशेंट एलोपैथिक मेडिसिन लेकर आया है, ऐसे क्या आप स्टेरॉइड दे दोगे उनको जो आपके एलोपैथी के पास नहीं है? दे नो स्टेरॉइड्स बेटर देन अस, राइट? तो whenever they accuse you of giving steroids, know that you are being successful. Further, on November, the creatinine level was 1.5. In January, the creatinine levels 1.36, almost normal. Almost the kidneys have come back to normal. So now I want to ask these people who do not believe in homeopathy, what pathy can bring a CKD patient to normal? There is no other pathy. Homeopathy is the best of the pathies, and I want you to believe in that. I am showing these cases. We all go to different seminars, right? And the doctor shows हम लोगों ने ये rubric लिया, this and I cured this and that, and when we try that thing doesn't work on our patients because it's their method is their patient. We will not get the same patient, we will not get the same rubric, we will not get the same medicine working for each patient. We have to experiment on our own, we have to follow our own way. My emphasis is on the fact that we need to read materia medica as much as possible and apply the medicines on our patients if we want to succeed. If we want to be accused of giving steroids, so fast results that you are accused of giving steroids, right? I think this session is going to end because the meeting time was only 40 minutes. 1 minute is left. When this meeting will end, I will send the link again because there are some very important therapeutics left and I really want to discuss that. So I am terminating this meeting here and I am making the link again. So just 1 or 2, after 1 and 2 minutes, I'll share the link again and you join the meeting, okay? So I'm stopping the meeting and we'll start with the therapeutic session after a little break.